Hey everyone, I'm Crystal, and in this week's discussion, I'm going to talk about herd immunity, infectious diseases, social distancing, and how all of these connect to women's health and public health communication. So, starting with basics, herd immunity happens when enough people in a community are immune to a disease, either through vaccines or because they've already had it. And when that happens, disease can't spread easily, which helps protect people that aren't immune. A good example of this is chickenpox. So, if one child with chickenpox is playing in a sandbox, that child could easily spread the virus to other kids who haven't been vaccinated with the varicella vaccine. But if most of the children in that community have received the chickenpox vaccine, the virus has nowhere to go. It just stopped spreading. So that's herd immunity in action. It's not about one person being protected, it's about the community working together to keep everyone safe. An infectious disease is any illness caused by microorganisms like bacteria or viruses that could be passed from person to person. For example, the flu. The flu is a communicable disease, a communicable infectious disease because it spreads easy through coughing or sneezing. Meanwhile, tetanus is a non-communicable infectious disease. It's caused by bacteria that enters through a wound, but it doesn't spread from person to person. Um, on to social distancing. It's something that we all learned about during COVID. Um, Basically, because keeping space between yourself and others slow the spread of infection. But just beyond physical distance, I think the main goal of social distancing is about protection and compassion. And it's also a way to keep hospitals from being overwhelmed and protect vulnerable people, like the elderly and children or those with chronic diseases. And it's just a reminder that sometimes doing less socially is actually does more to protect others. Challenges women face in healthcare. Okay, so when it comes to women's health, there are definitely some unique challenges. For one, a lot of medical research in the past focused mainly on men. So women's symptoms for diseases like heart disease or autoimmune disorders are often misunderstood or dismissed. And then you have an issue of priorities. So many women, also according to our book, many women are caregivers first and patients second. Between work, family, and responsibilities, it's easy for women to delay care for themselves. Speaking personally, I have firsthand experience with this issue when I was a single mother. On top of that, some women still face doctors who don't take their plans or symptoms seriously, which makes it even harder to get the right diagnosis or treatment in time. When it comes to public health communication, I think the most effective strategies are those that are clear and culturally sensitive and personal. During the COVID-19 pandemic, for example, people were more likely to trust information from local community leaders like pastors, teachers, or a neighborhood health worker rather than from national organizations alone. And we absolutely saw this due to a lot of misinformation and just crazy stuff at the time. The message basically has to come from someone people trust. Another great example is HIV prevention campaigns that use peer educators. So when messages come from people who understand the culture and the challenges of a community, they feel real and more relatable. And that's the kind of communication that inspires action. I think public health professionals do best when they explain why something matters, not just what to do when it does. So instead of saying get vaccinated or wash your hands, connecting these behaviors to family, safety, and community protection makes people actually care enough to act. Um, Regarding my preventative mastectomy example, I don't personally know anyone who has gone through that because of breast cancer risk, but I do remember when Angelina Jolie made her decision public. She found out that she had the BRCA1 gene mutation, the one her mother died from, which increases the risk of breast and ovarian cancer. And she decided to have a double mastectomy in addition to ovarian removal surgery to reduce her risk. And that decision got a lot of attention, and it also started a really important conversation about women's right to make protective choices about their health. The pros of that surgery are huge, is a huge reduction in cancer risk and the peace of mind that comes with it. And I would say the cons would most likely include the physical and emotional recovery process. I've heard it's rough, and how it might affect someone's body image or sense of femininity. I really thought Angelina's openness on a sensitive subject like that, like a preventative double mastectomy, made a lot of women look into getting genetic testing and actually talk with their doctors about options. So in a way, she helped made prevention a public conversation instead of private fear. In terms of COVID-19 and pregnancy, if I had a pregnant friend, I would tell her to be careful, but don't live in fear. Research has shown that pregnant women who do get COVID are more likely to have complications like preterm birth or severe illness. So I'd encourage her to stay up to date on vaccines, avoid crowded places, and talk regularly with her healthcare provider. I'd also remind her that her mental health is also just as important. So isolation and stress can take a toll on her body and as well as the baby as well. And it's about finding that balance between caution and harm. To wrap up, overall, whether we're talking about herd immunity, social distancing, or women's healthcare, the main idea is that public health is a team effort. The choices we make don't just affect us, they affect our families, our communities, and even future generations. And health isn't just personal, it's a collective. And when we combine the knowledge, empathy, and good communication, we could build communities that are safer, stronger, and healthier for everyone. Thanks for listening.